HealthWorks, infertility, it can impact both women and men. In general, it's defined as the inability to get pregnant after a year of trying. And while causes can vary and treatments can feel endless and expensive, the good news is there are a lot of good options. If you know anyone who has struggled with infertility, you know there is a huge emotional toll.
They're dealing with an emotional, distressful situation, a difficulty in their life. And you hear some of the stories, how it impacted their relationships, impacted their work, their family, their overall social well-being. So it's more than just procedures or treatment. There's a lot that goes into it from an emotional standpoint.
Dr. Ali Bazzi is the medical director at the new Michigan Fertility Institute in Livonia. He says it is never too early to start figuring out a fertility plan because age can start to impact a woman's fertility in her 30s.
Age, unfortunately, especially for our female population, age is a detriment to fertility. That we see an inverse relationship or a decline, significant decline with age, especially from a female perspective, and the egg quality and the egg count. And this goes back to the point where it's never too early to have this conversation.
Infertility can be diagnosed with exams, blood tests, and even ultrasound. Treatment options range from medication to insemination to in vitro fertilization, that's fertilizing eggs outside the body. But with all the options, Dr. Bazzi says there's always hope.
There's many ways to build a family. And it doesn't all necessarily intend IVF or any of the procedures we offer, sometimes adoption. We also have surrogacy. There are donor eggs, donor sperm. So there's many different ways to build family. And again, that all depends on the individual's way of life or relationship status. One of the big barriers to infertility treatment is cost. In February, President Trump signed an executive order to recommend expanding access to in vitro fertilization. However, the CDC team that researches IVF was subsequently included in the government layoffs. So the advice now is don't wait on policy to change if you're looking for answers. That's HealthWorks. I'm Dina Centofanti.